also the lip as well. And it's a congenital condition. That means you're born with it. And it's when the tissues or structures that form the lip, the upper lip or the lower lip, do not fuse. That means there's separation. It does not occur at the time it's supposed to occur. The child is born with it, and then you see a gap in the lip. It may be on one side, it may be on both sides. And then also in the mouth, that's the palate, the roof of the mouth, you may see a gap running from the soft palate to the hard palate, and even to where the teeth are supposed to be. So there are various types. It can be in conjunction with other medical conditions we call syndromes, and it may pose medical challenges and then social and psychological challenges as well.
How severe can it be?
So it can range from being mild to very severe, and also if it involves just the lip or just the palate, or in combination, that's the palate and the lip. It can pose feeding problems. As an infant, the baby may not be able to latch onto the nipple and then feed well, and so the child may have failure to thrive. That means may have difficulty getting nutrition and then surviving. The infant with cleft palate especially will have, if it's unrepaired, may have speech problems. Speaking will be a problem. May sound nasalized because all the air passes through the nose out, so you may not hear certain words properly, may not be able to pronounce certain words that require that you bring your teeth together really well. So they may have funny way of speaking, and aside that, we'll have psychological problems because it borders on the appearance as well, especially if there's the cleft lip involvement. So there's that psychological bit. If there are other syndromes associated, they would have a lot of medical issues that may require them have a lot of hospital stays and frequent hospitalization, hospital visits. So it may pose financial challenges, irregular attendance to school because of missing out on school work. So it may be affecting the quality of life as well.
Is this something that you would say, because it's your field, it's easy to detect?
Well, it may not be so easy to detect in our parts of the world because it will require 3D ultrasounds just to be able to see the child's face with the clefts.
Are you talking after birth, or even when the child is in the womb?
In the womb.
Okay.
That is if you are starting from there.
Okay.
If you take your ultrasound around the 5th month for any anomaly scan. If you have a 3D ultrasound, yes, the cleft lip may be detected, but with the normal 2D it may be difficult. Then if you're talking about the cleft palate, the chances are low because the child may, at that particular point, may have to open the mouth by some miraculous means, and then the scan will pick it up. But then in the third world country, the advanced countries, they have genetic testings as well, especially if it runs in the family. Somebody in the family may have had it, your husband has had it, your husband had it, your wife had it, an immediate relative. Then you can have the opportunity of getting genetic testing to see how much of a risk you are at.
So without these 3Ds and the 2D stuff you mentioned, the only way in our part of the world where we can detect somebody has a cleft palate or lip has to do when the child is born?
It's born.
Okay.
It's born, then where you can physically see it, diagnose it, and then refer for treatment.
I see. But what have you gathered? What causes cleft palate or lips?
So for a specific cause, it's been difficult to pinpoint. What we have now with our research findings is risk factors that would predispose somebody to get a cleft lip or palate. Now, there may be genetic factors where, like I spoke earlier about somebody in the family, maybe a grandparent, an uncle. That way it runs through the family, so genetically you may be at risk. And then nutritional factors. When the mother was pregnant, there were some nutritional deficiencies. We're not taking in folic acid or getting in the right nutrients from food. Maybe environmental factors, smoking, and now in the age of galamsey, you never know where your water source is coming from, so that may be a risk. Then also extreme ages of the mother or even the father, extreme ages being very early in their reproductive life or quite late also in the reproductive life can pose a risk. So these are some of the factors that can bring about.
Let's do a bit of exploration, explore a bit of the things you've talked about. So if you're listening to us right now and you are pregnant or your partner is pregnant, you need to be, take this conversation seriously, because you mentioned a few things. Smoking. Now, we know that it's prohibited to smoke in public. And again, we've heard that the passive smokers are even more at risk than the people who are smoking themselves. So when you're talking about smoking, are you talking about any ordinary smoke or cigarette smoke? And if a pregnant woman is in an environment where the cigarette smoke is rampant, can it affect the child? 2, you talked again about, not eating properly. When you say not eating properly, what do you mean? Such that if a woman is pregnant and is listening to us, she would understand that, listen, if I don't eat well or properly, it can affect the fetus or the child, or one child in my womb. So the 2 things, there's passive smokers, what kind of smoke are we talking about, eating well and all that?
Yes, what makes it even more dicey is the fact that cleft, lip and palate occurs quite early in the trimester, first trimester. Within 4th week of pregnancy to about 8th, 10th week, the lip and the face is forming. So the mom might not even know she's pregnant.
Okay. Wow.
When these structures are forming. So it's important that once you are in your reproductive stage, you start taking good care of yourself, where you live, where you work, stress levels. If you are in a high smoking environment, you make sure that you detach yourself, you don't smoke. Alcohol intake, we will not even advise that. If you're thinking of making babies, minimal. But when you start thinking of making babies, you may have to really consider that, and then advise yourself. Yes.
And the eating?
And the eating, yes. Well, a balanced diet, we always talk about a balanced diet, so we may really, not just because you're going to make babies, but for your general well-being. Yes, it's quite important.
So from what you've said so far, is it to suggest that it's not preventable?
Prevention, especially if there's the risk in the family, but I think education and knowing, because it's not just the only congenital disease out there are quite a number of them. So making sure you are healthy generally, and then being mindful of how you live your lifestyle in totality. Yes, so I wouldn't say it's preventable.
So which means it's not preventable, but there are some things that we need to be mindful of. So like you talked about, smoking, not to take alcohol, to eat very well, and also check if it runs in your family or of yours or that of your partner.
Yes.
Okay.
You're not taking good diets, maybe being on supplements that has been prescribed for you. Yes.
But having said all this, what would you say, are the biggest challenges cleft palate people face in Ghana? What are the biggest challenges that they face in Ghana?
I would say access to a comprehensive care. Access to comprehensive care, because cleft, lip and palate is to be able to get total care and rehabilitate the individual to society. It's multidisciplinary, involves a whole lot of specialists, and to be able to get access to that is quite rare, because in Ghana, Kolebu runs that, Komfo Anokye runs that, several places in the districts may run that, but if the parents do not get access to that, backed by financial prowess, they may have difficulty being able to totally integrate into the society because of how involving it is with the whole structures, with the face, with their psychological well-being as well. So will be access to comprehensive care.
So you're talking here about stigma.
Yes.
So let's say by way of stigma and let's say social perception, where are we? Have people come to terms that they are not children from, let's say, some gods? Have people come to terms with the fact that, well, it's a deformity, and if corrected, they can live a normal life? Have parents themselves come to terms with the fact that they don't have to abandon these babies or try to kill them? And